Go ahead, Alex.
So we're just gonna pop our.
You have to share the screen.
Share the presentation with you guys first, and then we'll do a quick introduction. All right, so my name is Ellipta McMillan. I'm a clinical resource educator here at Royal Inland Hospital in Kamloops, BC. I also sit on the Better Breathers Facebook page that some of you may be on, so you might recognize me from there. So I'm on there answering your questions when you have anything respiratory related. I've been an RT that's been working in Kamloops for the last 8 years. And yeah, I look forward and enjoy doing these webinars and getting to know you guys.
And I'm Lindsay. I am a colleague of Alexa's and actually graduated with her and Joseph back in 2014. So we've been practicing for the last 8 years. I work at Royal Inland Hospital as well. Currently, I'm the clinical instructor for RT students who are doing their clinical practicums. And I also teach at the university as well. So can you guess? We like to teach. So that's just a little bit about Alexa and I, and we'll move on. So today's topics that we wanted to focus on are common questions that we get asked when we're working clinically or teaching students or teaching our clients. And so this is just not an exhaustive list, but we wanted to include these questions. So we'll first cover why there are so many different respiratory medication devices. Okay, so we'll just touch base on that. We'll talk about how to use your device. We're not exhausting this category. We'll just talk about the most common ones. Then we'll talk about how do you know your device is actually empty of medication? Why do you need to take an inhaled steroid if it's been given to you? Why do you have to rinse your mouth? How do you know your puffers are working? And then we're going to give you an opportunity to ask us any questions that we may not have covered or didn't cover clearly enough. Okay?
Awesome. So as you can see, this is a diagram of all the different puffers that are out there on the market right now. So there's a lot of medications and devices out there. Each medication and device is prescribed for your individual need. So if your physician may prescribe a device based off your severity of your lung condition, or it may be your ability to use the medication or your ability to afford the medication. So there's a lot of questions when it comes around, well, so-and-so is on this medication, why am I not on it? Just know that there's a lot of medications out there and there's a lot of different reasons why we choose the medication that's best suited for you.
And I just noticed that there's a question in the chat box. If it's all right with everyone, we'll answer the questions at the end of the presentation. So why are there so many devices? Like Alexa showed in the last slide, there is a bag full of different devices that can be used to give you your medication. And so why are there so many options? Well, the device variety allows for individual needs, like Alexa said. So dexterity issues, some of them require a really hard push. And so not all of us have that strength in our hands to actuate the device. Inspiratory flow limitations, some of these devices need us to inhale at 60 liters a minute, which is really fast. And we may not be able to do that depending on our lung function. And then the last point that Alexa mentioned is cost or your drug coverage. You know, MSP only covers so much, and some of these newer medications can be quite expensive. So taking that into account, your physician, your nurse practitioner, your respiratory therapist, and your pharmacist will choose the best option for you, the best bang for your buck, if you will. So it's important that you do have the correct device for you, but if you have any doubts, please ask your physician, reach out to your nurse practitioner, like I said, the respiratory therapist, or even your pharmacist to see if there's something maybe better out there for you so that you can get your medication the best you can.
Awesome. So like I mentioned prior, there are a lot of devices out there. And these ones that you see in front of you right now are the ones that we're going to cover because these are the most common ones we see. If, however, what medications that we cover in the next couple of slides are not, if there's one that you are on that you do not see us cover, let us know at the end and we can talk a little bit about some of the helpful tips and common reminders for those ones.
So it's quiz time. Everybody ready? This is the fun part. What percentage of people use their device properly? And when you have an answer, feel free to unmute yourself and say which one you think it is. So is it A, 10%? Is it B, 25, C, 40, or is it D, 48% of people using their device properly?
A,
A?
yes,
Who was that?
Clancy.
Thank you.
Good job.
So we'll just go to the next slide.
That's correct. So only 10% of people actually use their devices correctly. So this is pretty shocking, but the important thing that we try to look at here is that if your symptoms aren't improving, or you get prescribed a medication and you're just not feeling like things are getting better, making sure that we're using the device properly. If you're not getting the medication, your symptoms aren't going to improve. So go back, ask your physician if they're not available or can't get you in, ask to be referred to a respiratory therapist, and they'll be able to go over that with you. If you are not, if you live in an area where you don't have access to a respiratory therapist, join the Better Breathers Facebook page. I'm always on there once a week answering these types of questions. And a lot of the times, this is one of the common questions I cover with people that ask, I was prescribed this medication, I've been using it for a month, it's just not working. And then I kind of go over, how are you using it? And we catch little tips and tricks of why they're not getting their medication properly. So super important reminder is making sure you know how to use that device. Which kind of segues us into the next point. So we're going to talk about some of the common devices that are out there and the important reminders for each one. So first one, why do I need to use the spacer with my meter dose inhaler? First, let me get this out of the way. So it is recommended to always use your spacer. So the spacer is that chamber thing that you see attached to the medication in that picture. It's always recommended to use that when you're using your meter dose inhaler. So I know sometimes there's some confusion on why or when I need to use it. It's all the time. MDIs, so meter dose inhalers, deliver medication at a very, very high speed. So we need to be able to slow that down to get it deep into your lungs. The analogy I like to use with this one is pretend you're driving a car. If you're going 100 kilometers an hour and you see a corner coming up, you need to slow down, or else you're going to crash into that corner. It's the same thing when we spray our meter dose inhaler. It sprays at such a fast speed, we need to slow those molecules down so that it can get around the corner of our mouth and go deep down into our lungs. And that's the purpose of the spacer. It slows down the medication once it's spread so that you can take that nice controlled, slow, deep breath in to get deep down into your lungs. So super important to always use that. Another important point is to only administer one puff at a time into the spacer. So some common errors that we see is if you're prescribed to take 2 puffs, puff it twice into the spacer and then take it, you got your 2 doses. Actually, you don't get your 2 doses. The medication needs to be sprayed once, you inhale it, and then we wait 30 seconds, and then you do the steps over again. If you spray it twice, you get what's called the propellant. And the propellant is a substance that's inside of the device that helps keep the medication suspended. So you won't actually be getting your full dose of medication, thus you may not be feeling better and your symptoms might not improve. And then lastly, medications will settle and stick to the sides of the chamber. So you got to make sure once you spray it that you're ready to take that breath in. You do have some time, so you can get it all set up. Once you spray it in there, then concentrate on taking that slow, deep breath in, but don't spray it, wait a few minutes and chat, and then take it. It's going to settle and stick to the sides of that chamber. So to the left of their page, you'll see the steps of how to use your MDI with a spacer. I'm not going to go into that, but if we do have questions, just raise your hand at the end and we can cover that. But some of the important reminders with using your meter dose inhaler with your spacer is making sure that it's always primed prior to use. So if it's your very first time using your meter dose inhaler, you get it from your pharmacy, you want to make sure you prime it, or if you have not used it for 14 days. So priming it is when we shake it and then you just spray. If it's been the first time getting it, spray 4 doses and now it's ready to use. If you haven't used it for 4 days, then you're just going to spray, waste one of those doses away. Again, like I mentioned, we're only spraying 1 puff at a time into the spacer so that you're taking 1 dose at a time. We're always waiting 30 seconds before we spray and use that meter dose inhaler again, because that's the time that it takes for that canister to repressurize to get that propellant and the medication resuspended inside of the canister. When you're using your metered dose inhaler with your spacer, if you hear a whistling sound, it's letting you know that you're inhaling too fast, and it's just telling you, hey, take a slower breath. Again, it sprays at a super fast speed. So if you're taking a really fast breath in, you're still doing the same thing where you're causing those molecules to hit the back of your throat versus taking a nice big controlled breath deep down into your lungs and getting that medication deep in. So it's called a coaching whistle. A lot of these devices, the metered dose inhalers, do not have a dose counter. So if yours does not have a dose counter on the back, so your Ventolin, your Atrovent, your Flovent, you're gonna have to keep track of those doses. So right from the very beginning, when you get it from your pharmacy, when you prime, you got to count those doses. So if you're wasting 4 away, when you're priming it, you got to count that down. And then every single time you use it, it's not going to tell you when it's empty. Super important point to remember about that, because a lot of the times when your device does run empty, you will still be able to have to spray the device out, and you're actually spraying the propellant. There's no medication, and you're just getting just the propellant. So it's still spraying. So you may think that you're getting medication, but you're really not. And then again, that's going to cause some of your symptoms to come up. So very, very important to make sure that you're counting those doses.
And finally, with the MDI in the spacer, I think a lot of us tend to forget to actually clean the spacer. We use it, we're putting medication in it, and if we're using it regularly, really it should be cleaned about once a week. If you have more than one spacer, you've got one for your Ventolin, one for your Atrovent, clean them all regularly once a week, okay? On the left-hand side of the screen, it shows the images on how to clean it. So it's important that you take your MDI out of your spacer, pull it out of that rubber end. We don't want those to go into any water. So pull that out, set it aside. You're going to remove the mouthpiece if you're able, and take that rubber end off like the first image shows. And then you're gonna run the sink full of lukewarm and use dish soap, okay, and make it sudsy. You'll take the bits, swish them inside this lukewarm dish soapy water, but you will not scrub the inside. If you scrub the inside, even though you think your washcloth is gentle and soft, it can actually score the inside of the spacer, creating these little grooves for the medication to settle in instead of going into your airways. So we don't want that to happen. We want you to be able to get the most of the medication. Once you've switched it around, you can go ahead and rinse the mouthpiece so that you're not tasting soap, and then put everything else on a dry cloth to air dry. Okay, don't dry it out to hurry it along. So timing of this, usually do it after you've taken the last puffers for the day, or you have enough time for it to air dry, and then go ahead and reassemble everything together. Oh, thanks, Lex. The next really common device that we see is the Turbiahaler. Some of you may have seen it. It's kind of one of our oldies, but a goodie as well. This one has dry powder inside of it. So we want to keep it away from moisture. Any dry powder inhaler, keep it away from moisture. With this one, oh, there we go. I see Ken pulling his out. With the Turbiahaler, you do not need to shake it before you use it. If you do shake it accidentally, you may hear something rattling around. That's okay. It's not the medication. It's that drying agent to keep it nice and dry inside. Okay. If you exhale into the Turbiahaler before you take your dose, there is moisture in your breath, and you can risk clumping or blowing away the medication when you've actually loaded the dose. So when you're about to take your puff in, breathe out to the side, okay? If you accidentally do that, or you tilt it over after loading the dose, that's okay. Just follow the steps from number 1 again, and then take your medication. You will not get a double dose with this device, okay? Finally, like I said, keep it away from moisture and water. Store it in a dry area at room temperature. Keep it out of the bathroom. If you have steamy showers or really steamy baths, keep it at your bedside table so it stays nice and dry. And then luckily, this device does have a dose counter. So when you note that the dose counter has gotten to red, that's your warning sign. Hey, you've only got so many doses left. Get ready to get your refill waiting for you so that you don't miss a dose in between.
Good, awesome. How to use your Respimat. So this is a newer device on the market. So with this one, you do not need to shake the Respimat before using. There was some common some physicians and some pharmacists that were saying you can use it with the spacer to get a better delivery into your lungs. You do not need to use a spacer with this device. It is already what's called a soft mist inhaler. So it's going to come out soft, like misting into your mouth. So it's not coming out that fast speed like the meter dose inhaler is. So no need to use it with the spacer. You got to prime the Respimat after the cartridge is installed. So when you pick up your prescription from the pharmacy, ask them to load the cartridge for you, as it can be a little bit tricky. Sometimes it takes a little bit of force to really pop the cartridge in. Just ask your pharmacist to load. You'll know it's properly loaded. Then you'll have to what's called prime it. So in the first picture you see there, the cap's on. You're just twisting the bottom 180 degrees. You'll pop it open and you'll waste. You'll push the button and waste it. And you're just going to keep repeating those steps until you see a full mist come out. So then once you do that, you know it's being primed. You'll only have to do that again if you have not used your Respimat for 21 days. So again, ask your pharmacist to load it when you're picking it up, then you know it's loaded. It does take quite a bit of force to push down, and they do not mind loading it for you. Other things to note, if you look at point number 4, there's little vents on the side of the Respimat. Some issues that we have seen, patients will have their lips over top of those vent ports, so they're not able to take a big breath in. They're unable to draw air into the side. So make sure your fingers or mouth are including those little vents so that you can take that nice slow breath in. The great feature with this device is that when it is finished, so it does have a nice big dose counter along the side, but when you've used all the doses, it actually locks at the very end. So you no longer can keep twisting it when there's no more medication in it. So I do really like this device for that purpose. And the last device that I believe that we're going to cover today is the Discus. So another really common device out on the market. So some important reminders with the Discus. Again, you do not need to shake this device. It has a powder inside of it. So you want to make sure that we're not shaking and rattling that all up. The only device that we're really shaking is our meter dose inhaler. Once you've loaded your Discus, so step 2, once you've hold it horizontal and it's been loaded, you want to make sure that you're keeping it horizontal. If you tip it or if you drop it, just close it up, reload it, and make sure that you're getting the proper dose. You cannot double dose again with this one, but it's important that we're making sure that you're getting the full dose. So if you tipped it, you turned it from its horizontal spot, if it's turned vertical, then just ensure that you're getting that proper dose by closing the case back up, opening it back, and reloading that dose. Again, as you can see in the picture, he's making sure to hold his Discus horizontally. That is super important. When the medication is loaded, it sits on a little pan, so you want to make sure that you're not tipping that medication out. So it's super important to hold that horizontally. For cleaning, like Lindsay mentioned with the Turbihaler, because this is a powder, we want to make sure that we're keeping it away from any moisture, any water, so storing it in that nice dry place, room temperature. If you need to rinse off the mouthpiece using a dry cloth to wipe it off, if you've used it with lipstick or chapstick and you just want to give it a little wipe, use a dry, clean cloth, because if any moisture or water gets in there, it's going to clump the medication. This device does have a dose counter on it, which is great. When you see the numbers turn red, it's usually around 5 doses. That's an indication to you to call your pharmacy to get your medication, your prescription refilled. And when it gets to 0, that's how you know that your Discus is empty and there's no longer any medication in it.
Nope, we're going to do the Ellipta. So Alexa Live, there's one more device that we're going to cover. It is the Ellipta, and this is a newer one that's been on the market for about, I'm going to say about 5 years now, maybe. Yep. Yet again, this is a dry powder inhaler. So I'm assuming we've all made the same assumption that keep water away from dry powder. Love it. With this one, yet again, you do not need to shake it. When this is brand new, it's going to be in a foil package. So it's ready to go as soon as you open it up. Okay. To load the dose, as you can see in the image number 1, all you have to do is slide that top cover over and you should hear a clicking sound. In addition to the clicking sound, that dose counter that his lovely thumb is blocking in the image should count down by 1. Okay, there should be 30 doses generally in there. So it should go from 30 to 29 when you first use it. If when you open this up, you slide the cover and you hear a click, but the dose counter does not decrease by 1, then you are not loading a dose and you will not get any medication. So go ahead, take that back to your pharmacist and get it replaced because there's something defective with the device itself, okay? Yet again, with all the dry powder inhalers, if you drop it after loading the dose or you exhale into it, just think you've lost that dose, okay? And then start the steps over again. So close the cover, open it back up, hear the clicking, look for that dose counter dropping down by 1, and then hold it ready to go as you're exhaling to the side, okay? As I mentioned, the medication comes in a foil package. And so there is an expiry date on the device itself and the medication that's already in it. There is a 6-week expiry date. So ensure that you're writing on the actual device when you opened it or when the expiry date is going to be, whichever you prefer. Generally, these devices have our maintenance medications in them, so you're taking it once a day. So you should use it up well before that 6-week time frame runs out. But it's always important to make sure you know, okay? Like all the dry powder inhaler devices, you're going to wipe them with a clean, dry cloth, making sure the mouthpiece is nice and tidy, and then store it in a dry place away from any moisture. Okay.
All right, so we're going to switch it up to some frequently asked questions that we typically get. How do I know when my device is empty of medication? So as you've heard, Lindsay and I talk a little bit about dose counters and some of these devices. So some of these devices come with dose counters and some do not. So devices with dose counters typically are newer devices on the market. They're a good reminder to call your pharmacy when you see the number turn red or a flag. So typically there'll be some sort of change in the number, and that lets you know, hey, I need to call my pharmacist and I need to get my prescription going to pick it up in the next couple of days. And then some newer devices like the Respimat will actually lock, so you can't even load a dose or try to load once they are completely empty. Other devices like our meter dose inhaler, our Ventolin, our Atrovent or Flovent, some of those devices, they do not have dose counters. So it's super important that you will have to keep track of how many doses you have taken. And it's not just doses you have taken, but also the doses that you have used to prime that medication. So some of the tips I'll give some of my clients is the box that it comes in, your meter dose inhaler, do a little tally on there. Or if you're taking that medication regularly, if you have a prescribed, take your Atrovent 2 puffs 4 times daily, you can calculate on your calendar when it's going to run out if you're taking it as a maintenance drug. So you'll be able to say, on this day, I need to go get it refilled. So just have some sort of system that works best for you when you don't have dose counters. So that device is empty.
Another really common question that we are asked is, why is oral hygiene so important? More specifically, why do I have to rinse my mouth? What happens if I don't rinse my mouth? And why should I rinse and spit with water or brush my teeth? Well, why do you have to rinse your mouth? You're rinsing your mouth when you take an inhaled steroid. That's one of those maintenance medications. If you don't rinse your mouth and spit after you've taken it, then there's a risk of developing thrush. It's a yeast infection in the mouth because that steroid can kill all the good bacteria and just leave that yeasty stuff. So we don't want to have that happen. It's easy to get and it's slow to get rid of. So then why should you rinse and spit with water or brush your teeth? Well, commonly we hear patients using or clients using sugary drinks, soda or juice, and they rinse and they swallow instead of rinsing, gargling, and spitting. We don't want you to swallow after you've rinsed your mouth because there is a risk of you ingesting that that steroid, and that's what causes side effects. And it can also lead to you developing thrush because you haven't spat the steroid out of your mouth, you just swallowed it down into your throat. Okay, good.
Awesome. So kind of leading on to that, we get a lot of questions, why do I even need to take an inhaled steroid? This is a lot of people get confusion over this and almost fear over, why do I need to take an inhaled steroid? Inhaled steroids are super important when it comes to management of certain lung conditions. They help control and reduce the swelling within the airways. And it's important to take them regularly as prescribed. If they're only taken, as you feel, you're not going to allow that swelling to be maintained and reduced. So like I mentioned, it helps lots. We use it for maintenance for asthma and to prevent COPD flare-ups. The biggest error we see is people not taking them regularly. So they'll get prescribed, say, Flovent or some form of inhaled steroid. They'll take it, they'll start to feel better, and then I'm going to try and wean off my inhaled steroid. And then their flare-up happens again. Swelling starts building up in the airway, and then you have that asthma or COPD flare-up. So it creates this kind of, circle of flare-up, treatment, flare-up, treatment. And we just want to prevent that. The more and more flare-ups we have, the more swelling we have in the airway, we can lead to changes within our lungs. So it's super important that we just maintain and prevent swelling within the airways. So taking them regularly to reduce that. So again, what's the most common question that we get asked? What are the side effects from taking inhaled steroid? And, there's this common misconception that inhaled steroids have the same side effects as oral steroids, but they're different. Because inhaled steroids interact with the tissue within the lungs, when they are taken with the proper technique, their effects happen within the lungs, not within your whole body. Systemic steroids, they're ingested. So they tend to work within the whole body and have more systemic body-wide side effects. So if used directly and used properly with how the device is supposed to be used, the medication will be used within the lung and target that swelling within the lung and should have very minimal side effects outside the lung.
Yeah. Okay. All right, the last question, which is an oldie but a goodie, is how do I know that my puffers are working? So with bronchodilators, how do we know that they're actually working? Well, they come in a few different classifications. We've got short acting that are fast and they last for only about 4 to 6 hours. So you only get a bit of relief from them. Then you've got longer acting, slower to work, but they last much longer for continued relief and symptom management. So those are your long acting ones. And then you've got fast acting bronchodilators. That's your rescue inhaler. It's going to start working within 2 to 5 minutes and let you feel that relief. So you know your bronchodilators are working because you feel that relief. But how do you know other medications are working? Well, what about your inhaled steroids like Alexa was saying? They are used to reduce inflammation, but they do take up to 2 weeks to actually start working and for you to actually feel the benefit. So that's why staying on schedule and regularly taking your medications is really beneficial and important. You will not feel the effects as quickly as you would with bronchodilators, like I mentioned, but they are extremely important medications to prevent further lung damage and then further lung scarring, which is something that's irreversible. So staying on top of these medications is extremely important.
Absolutely. So remember, give yourself a month to use your medications as they're directed. If you do not notice a change in your symptoms or you're just not feeling better since you started using them, make an appointment with your doctor, your nurse practitioner, your respiratory therapist. A lot of times people just don't give enough time to see, is the medication working, especially those maintenance ones that have that inhaled steroid. It does take a few weeks for some of these medications to really start fully working within your body. So, give them at least a month to work and then reassess. Are my symptoms getting better? Do I feel better on this medication? It's important. You need to be using your maintenance puffers regularly. So your maintenance ones are the ones that your doctor has prescribed for you to take daily. If you do not use them daily, then that allows for inflammation or your lung airways to be more reactive. So you want to make sure that you're using them regularly and you're using your device correctly. If you are unsure that how you're using your device, either make a doctor's appointment or referral to your respiratory therapist, or jump on to the Facebook page and ask me, and we can further dive down and I can help you review that. No problem.
Awesome. So thank you so much for your time. We appreciate you coming to listen to us speak. I know that there's some comments in the chat box that'll open up, and we want to open up the floor to anybody that has any questions. So please feel free to unmute yourself. I think maybe we'll just jump into the questions that were already typed in. George, you were never given a spacer. So that's a common thing for us to see and hear about. So there's a couple things you can do. You can go to your pharmacy and purchase a spacer. And it depends on what pharmacy you have available. Alexa always knows the best place to get those.
Usually Costco is the cheapest, and you do not need a Costco membership to use their pharmacy. Costco tends to have the best prices when it comes to drug coverage and all these extended stuff. Spacers are not given out with MDIs. You have to purchase them separately, or when you're in a physician's office, or sometimes when you're in a community respiratory clinic, they will give them with the MDI. But this is one huge error that we unfortunately see at the pharmacy, is that they just assume you have a spacer. So it's really, really important. That's why we're always reiterating this message that you need to use a spacer with your meter dose inhaler to get that medication.
And that would include like Ventolin HFA, correct?
Sorry, say that again?
I'm using Ventolin HFA.
Yeah.
Yeah. Okay. No, it's just kind of, it's very interesting. This is the first time I joined your group, and I really glad I did.
Oh, lovely.
Nobody ever talked to me about a spacer, so I have just been inhaling it and taking a deep breath and then exhaling it.
Okay.
Yeah, and then like unfortunately, like there's so many people that are in the same boat as you. We get this like question. This is probably one of the most common errors and things that we see. I'm not sure why they're just not giving the spacer with the meter dose inhaler as is, because the medication, the majority of it is staying in your mouth. So you're not even getting that medication. So you're not getting that symptom relief. And you tend, we didn't really touch on this too much, but you tend to get more of the side effects from the meter dose inhaler when you don't use it with the spacer. So if you're using Ventolin, you may notice that you feel more jittery after using it. That's because more of the medication is going into your bloodstream, which can give you the jitters versus deep down into your lungs. So using that spacer, depending on whatever medication is, it's going to really reduce the side effects of that medication. So really, really important. And I'm sorry that you were not advised to purchase a spacer. The other thing to kind of note with that is that there's so many different spacer model types on the market. You do not need to go and buy the most top of the line spacer out there. It's the sole purpose of the distance once you spray to help slow down the medication. So even just like your very generic spacer, if money is an issue in that sense, that's going to work. That's going to help get that medication deep down your lungs. When we go and teach in third world countries, we teach to use it with the pop can. So just being able to slow down that medication, you're going to get more of it. There are some spacers on the market that last longer. They have the ability, you can put it in the dishwasher to clean. So it just, talk with your pharmacist, and when you go to the pharmacy, they'll be able to give you the options out there. Or if you have access to go to a respiratory clinic, or if you are unfortunate enough to have to go to emerge because of your breathing, they will give you one. So those are kind of your options.
Yeah, it sounds like something you probably don't need a prescription for.
No.
No, you do not. You can go anywhere and just ask for them. And you can also ask your physician to put it on your prescription as a reminder to the pharmacist to ensure that you're leaving with one, or that they ask you if you do have a spacer.
Okay, very good. I appreciate that.
Yeah, no worries. That's exactly the kind of things that we love answering.
Right.
Maureen, how many doses does Ventolin have? Generally, it's 200 in one of the MDIs.
Yeah,
correct.
So how would I know that?
So do you have it with you?
I do.
Okay, so you can see that there's the plastic kind of boot looking part.
Yep.
And then you got the little metal canister. They actually separate.
Right.
So you can pop those apart, and then there's a lot of very small print information on that canister. So it will tell you the dose of each puff. It will tell you the medication. But then at the top, it should have in little writing 200, and that's how many doses you have.
Okay.
it will also say when you get it, the medication will come in a box. It will say it a little bit bigger on that box too. It'll say 200 on there. Atrovent, they all have a little bit different dosing on there. So just make sure you know. If you're unsure, ask your pharmacist or
Well,
call
on
your
the
pharmacy.
label, on the label on this, it says, and this is on the label that the pharmacy puts on. It says 400 DOS. What does that mean?
So each puff of your MDI has 100 micrograms of the medication. And so what they're telling you is they want you to take a total of 400, which would be 4 puffs of the medication.
Oh, okay.
Yeah. Did they write 4 puffs once a day for you, or at night, or?
I get 2 puffs 4 times a day.
There you go. Yep.
Oh, so but that's not telling me how many doses there are, so.
So
Okay.
each dose, oh no, but that will be on the actual canister itself, and then they just pop back together.
Right. Okay, thank you.
You're very welcome.
Alexa, my pharmacy puts on as an example 600 DOS, and that means I got 3 Ventolin, each with 200. I ordered 3 to last me till the next month, right? And so they're putting down the amount for the whole order, and it really confused me at one time. And the Inspialto Respimat, where the red and that to show the stop and the number of puffs that you can get out of it is really a miss. We'll run past having used the medication by 5 or 6 days. And I phoned the factory and I asked, why I was getting this extra, and they said others hadn't complained about it, but that I should only do what I correctly counted, for the 30 days. And because after that, they can't ensure that I'm getting the proper dosage.
Yeah.
So I'm just suggesting to anyone using it that you're to prime it till you see the fog, and then 3 more times. So that's at least 4, and then start counting the 1, 2. And, it might be worth it while to check it for yourselves. Thank you very much.
Yeah. Thanks, Doreen.
Great tip. I haven't personally run into that at all. We've always just been taught that it will lock out once the medication's done, but we want to make sure that you're getting medication. So that's a really important, a great tip.
It used to do it that way too. And the little red bars in that and the start green, they were all lined up.
And now not happening, eh?
No, I think it was a cost cut back or something.
If that happens again, Doreen, I would suggest, you won't really be able to tell until you're at the end of your the Respimat once it's run out. But when you go to get your next one, alert your pharmacist as well, because they can track the lot number and contact the manufacturer as well and see if maybe there was some issue with that lot of devices that were created.
Yeah, because the mist should always should stop misting once the medication's done, because how that device works, unlike the MDI where you can keep pressing and powder or mist will come out because of repellent. That device is a little bit different, where once it stops spraying, there's no longer any medication. So I'm interested to see.
Thank you. I never thought of the pharmacy.
Yeah.
And I did check in the factory, and yeah, that's what was happening. But I don't think they're that concerned about it. But of course we are.
Yeah, absolutely.
Yeah. So you got to look out. You have to be your own advocate, right?
Because missing 3 days of the medication at the end of every month, I'm going to start having not have the health that I'm able to have.
Yeah, exactly.
So I see lots of questions here.
Yeah.
We'll keep powering through.
And nobody's guilty of anything, Ron. You just weren't told the right way to do it, and now we've done that. So no guilt there, okay?
Okay, thank you.
Yeah, of course.
And that's a very common question. Everyone's like, well, I've always just told to rinse my mouth. And you think rinse your mouth, let's have some water, swallow it. But it is, another common thing that we see. So don't feel guilty of that or feel bad.
We can't all be perfect. Just close to it.
Definitely change my ways.
Joe, you asked, is there any role in holding breath while taking medication? Is that the breath hold when we're taking the puffer? Is that what you're asking?
Holding breath.
Yes, that's right.
Okay, yeah, it is. When I do my education, and I think Alexa probably does the same, whenever I teach patients or clients to take their puffers, I always say, think about, that smooth breath in that's going to carry your medication around all the corners. Like Alexa said, you have to slow down to drive around the corner. So I think about a river, right? You got to slow down to get around all the bends of your airways. And then you need to hold your breath for a count of 10 or as long as you can for that medication to settle like a mist into those itty bitty little airways that really need the medication. So that breath hold is paramount if you're able to do so.
Yeah, when I do the teaching, that's the main thing I concentrate on the patients, like holding the breath. Because what I've seen is most of them, they didn't even hold it. They just take a breath and just breathe out. And if they didn't, so I try to emphasize on the holding breath because not just for medication, it also helps with the lung capacity as well if they keep doing it.
Absolutely.
Now, I just want to add on a little note to that. That is the optimal way to take a medication is one smooth breath in and a breath hold for up to 10 seconds if you can. But if you cannot, because you are so short of breath and you have your MDI and it's your rescue inhaler, that is all right to do what we call the multi-breath technique. And for adults, it's about 4 to 5 breaths in and out, where you do all the steps the exact same way. But when you get to the point where you're going to actually take your breath in, instead of that one slow one, just breathe in and breathe out and breathe in and out 4 to 5 times with your mouth on the mouthpiece of the spacer. And that will get medication in to help you catch your breath. So then when you're able to, you can do the preferred method of the long and slow. So really good point, Joe. Yeah.
Good to
Even
know.
with Trelegy, you would want to hold your breath for 10 seconds?
Sorry?
Even with Trelegy, a powdered?
Yep, yep.
you would wanna
All
hold your breath for
devices.
10 seconds, okay.
Yes, sir.
Okay,
Yes.
Best
thank you.
practice is when you take that big breath in, try and hold for 10 seconds and then out through your nose if possible.
Okay, thank you.
Yeah, very
Absolutely.
good question. Yeah.
Hi, Alexa and Lindsay.
Yeah.
So I think the next question in chat is about oxygen. So
Sure.
maybe if John or Joseph want to like maybe jump in for this one. So the first question is, what is the normal oxygen level? And this is from David. And then the follow-up question is, if we are instructed to use level 3, what is the effect of changing that to level 2 to enable the battery to last longer?
Hey, John, do you want to take the question?
You're on mute, John. You've got to unmute yourself. Oh. Oops.
There
Okay,
you go.
are we talking about using a battery-powered portable concentrator here?
Yes.
Okay. Well, people often have their own oximeter, which enables them to self-diagnose their needs, when the oxygen concentration, when your oxygen levels go down below 90% or 92%, they know it's time to make adjustments. Well, there's good and bad about that. There may be some underlying pathology that's developing that, you know, a cold or a lung infection that's increasing your need for oxygen support, so that by self-medicating, you may increase or you may mask the onset of those of that new pathology. So how do you know when? What's a normal level? That's a question I always suggest people discuss with their doctor. Are they CO2 retainers? What's their level of ventilation? Because it's kind of a long story, but your brain triggers breaths based on information it gets from sensors. And if you have a chronic condition that's developed over a long period of time, your body may have made adjustments. So what's a healthy level for one person may not be a healthy level for another person. So you need to, and you need to get that discussed with your doctor, because when you were prescribed oxygen in the first place, they drew a blood gas. That information would be made available to the doctor at that point. Ourselves in the home oxygen business, we quite often don't get that information. We focus on the oxygen level, and that's not necessarily the complete picture. So you need to find out, am I a CO2 retainer or not? And if you aren't, then 95% is a good number. If you go below 92%, you need to increase your oxygen, but you need to communicate that to your doctor because there may be some underlying developing pathology that's causing that increase in need.
Thank you, John. Would your normal GP be able to tell you that, or do you need a respirologist for this?
No, your normal GP, he has access to the clinical information when an arterial blood gas is drawn in the hospital, wherever. That would go into your file, and if the global file system is working in your hospital, your doctor would probably be aware of that. He should be anyway.
Okay. And what is the effect of reducing it from a 3, let's say, to a 2, which now gives you less oxygen, but makes the battery last a little longer? Would you if you borderline, it would probably not change your effect on your body too much, would you think?
Well, why would you want to reduce just to save the battery? Is that your only concern, saving the battery?
To use it, you may be in a situation where you're going to run out of battery before you can get home or anywhere to recharge it. And so, you need to make it last that little bit longer, if you like.
And I'd shoot it down to 2, no matter what. Yes, that's what I would use.
Better than no oxygen.
Yeah, okay.
Yep.
Joseph,
It makes quite a difference.
No, I agree with you, John. So I always think about it's better than no oxygen. So it totally based on what you have and what's best, right? It's the ultimate goal is to not to have your oxygen below normal all the time.
Not too long, yeah.
Yeah, but if that setting helps you to reach your home, but not that's much better than not having anything and just stuck somewhere.
Okay, thank you, John. Thank you very much. Thank you.
Oops.
Awesome. So we can jump to the next question if we're done with that. So George asked, can you please explain what a flare-up is? Is this just being out of breath? And great question. Sometimes some of these terms get used and we're unsure of what they mean. So great question. So a flare-up is when there's any change in your lung condition. So whether that be increasing shortness of breath, a change in your cough, whether you have a cough and then you don't have a cough, now you do have a cough, a change in your mucus production. So every single person's going to have different criteria of what a flare-up will be for them. So that's why it's super important to know what your baseline symptoms are. If you normally, when you're feeling good, just normally have a dry cough, then if you start noticing that you're coughing up mucus and you're feeling really short of breath, that is called, you're having a flare-up. So super important to know your baseline and when you're deviating from your baseline. And that is when you're having a flare-up. So I hope that answers your question.
Yes, it does. I rarely have phlegm, but occasionally I will, and I rarely cough. But occasionally I will, and when I do, it's because there's phlegm that I can't get rid of. And once I do get rid of the phlegm, I feel much better.
Awesome.
So that would be considered a flare-up, I'm assuming, if I'm coughing up phlegm.
I might be able to help answer this. Do you have an action plan with your physician?
How do you mean action plan?
So there's action plans, asthma or COPD, and what they are, and they're different for everyone. But essentially what it is you working with your physician to identify what your best work of breathing, your best baseline is. So how often do you cough? How much sputum do you produce? Is it colored or is it clear? And you go through this list of questions, and that is what we call your green zone. That's when everything is good to go. When you know that there's a change in your normal baseline, then you go into the yellow zone, like pre-warning zone, that something is changing. Whether you, like you said, when you get more sputum, you have to cough, and so that's a change from normal. Or if you know that you normally can walk down the street on a level surface and you're not short of breath, but then all of a sudden you're having to stop every 10, 15 feet because you're so short of breath, that's a change in your normal. So that is the window for you to prevent getting to the red zone. And so with your physician, you should have an action plan of either a steroid on prescription at your pharmacy or antibiotics.
Or step up therapy, depending on what medication you're on. They'll say, you know, you're only using this once daily. If you're in your yellow zone, step it up to doing it twice daily. So depending on what medication you're on, your action plan will be designated based off of your medications.
And the whole purpose of this is to prevent you from going to the red zone. The red zone is where, for lack of a better term, things are kind of now out of control. Whatever's going on, potentially an infection is now really kind of raging and it's creating havoc in your body. And so we want to prevent that from happening. We want to stop it in its tracks. If you're in the red zone, that's when you'll go see your physician if you can, or if you cannot, or you do not have one, get to the emergency department at your local center.
Yeah. And then super important, if you do have a flare up, go back to your doctor or your respiratory therapist or whoever you're followed by to reassess. Sometimes our baseline symptoms, we don't go back to them. So we go back to a different normal. So it's super important that you're always just understanding of what your normal is or new normal after a flare-up. So that's something it's just super important that if you're having these reoccurrent flare-ups, that we are looking at your medication, whether that's, are you on the right medication for where you're at in your disease process, or are you using those devices properly? Sometimes it has nothing to do with either of that. Sometimes it has to do with the triggers that are in your environment, especially with asthma. If you're sensitive to dust, if you're constantly being exposed to that and having flare up, then they're going to look at it that way. Like, what's triggering you to have these flare ups all the time? So there's a lot of different pieces that they look at. Sometimes it's not just strictly medication, but we want to make sure that we're preventing you from constantly going into flare ups, because that can change what your lungs look inside, and sometimes we can't go backwards. We want to make sure that we keep you nice and healthy in that sense and preventing things from progressing.
Very good. I appreciate that. Yes. No, and answer no. We have no plan or red, yellow, or anything.
So you can look that up on your own online and see what one looks like, and you can start thinking about what your normal is. And then when you see your physician next, go, can we complete this together?
And
Okay,
when you can make a physician appointment, ask them, I would like to make an action plan, because they make just a little bit more time to be able to type that up and go over it with you. They usually make it a 30-minute appointment versus that 15-minute appointment that you get for your physician. So let them know that's why you want to see them.
Okay, I appreciate that.
Joe's
Thank you,
just put
Jason.
Joe's just put an action plan I see in the notes, so maybe we can send that out, an example. Oh,
Yeah,
Jason,
Awesome.
Jason,
thank you.
excuse me.
And then
Just know that that's an example. It's super important to get one made up for you.
yes.
Okay, no, I think that's a great idea. I had no idea that I should be talking to my doctor about that. A lot of times physicians are great, but they don't always offer information. You have to kind of pull it out of them.
Yeah, they're busy. They've got so much going on, but they try their best, so
I
we
know.
gotta love them.
Like right now, I'm fine. I've been fine all day, but tonight, I'll be honest, I'm going bowling. I'll get out of breath when I'm bowling.
Yeah.
And is that considered a problem or not?
No, you're exerting yourself.
Do you have what's called a rescue puffer to take?
That, well, my Ventolin HFA, I'm assuming, is what I'm using for.
Absolutely. So
Yeah.
you can use your Ventolin with your spacer prior to exercise. So Ventolin does take about 3 to 5 minutes to start kicking in, but prior to exercise, what we recommend is take it 15 minutes prior to going bowling. It's going to last a couple hours, so it should last you the time that you're out, and that's going to prevent you from feeling short of breath. So we sometimes recommend that if you know that you're going to go do something that when you physically exert yourself that makes you feel short of breath, taking that little salbutamol or Ventolin or whatever one you have to help with reduce the shortness of breath so you don't feel that.
And also listen to yourself when you're bowling, depending on what disease process you have or what's going on with your lungs. It may be that you need to throw a breathing technique in, or if you feel like you're winded, allow yourself to catch your breath before you start doing, like, throw another ball or another strike or whatever you're going to end up doing. But,
Okay.
right? You're going to have a good game tonight, but make sure that you're aware, like you listen to your body and sit down, catch your breath if you need to. Don't push through it because there's no pushing through it.
Okay, so
You should do the deep breathing.
Not a good idea.
Do the deep breathing, purse your lips when you exhale, and that should help as well if you've got what we call an obstructive disorder like COPD.
Right, okay.
Yeah.
Okay.
And then for your poor cat, I don't know what to say.
So
Our
well,
apologies.
Yeah, no, I'm definitely glad I joined this group, because like even when I work downtown.
Yeah.
And a lot of times I have to walk 5 or 10 city blocks from the parking lot, and I do stop and take a break in between
Yes.
buildings. And it's winter time now, so that makes it even worse. Where I'm at, I'm in Chicago, so.
Yeah, wow, lovely.
In Chicago.
It's freezing.
I see, Alexa, we have one more oxygen question. I thought maybe we could try and
Yeah.
slip that in. What do you
Yeah.
think?
Yeah.
I don't know. Maureen's gone. So I say, if you felt you needed oxygen for going out, but you're fine in your home, a short walking distance is being suggested. Would you go to Vital Air on your own, or do you go to your doctor first and get tested before you go to Vital Air? And that's from Gina. I don't know if Joseph or.
Oh, I
John.
would go to your doctor right away.
Okay, you guys.
Yeah, because it isn't necessarily needing oxygen that is making you feel short of breath. It could be lung function. Your oxygen levels could be perfectly fine and normal, but it could be the way that your lung is functioning and you're not being able to get all the air out, and then there's no room for fresh air to come in. So if you go to your doctor first, they will help you identify if it's necessary. I used to work at a company that did home oxygen, and people would come in and purchase it themselves, and it's pricey. And without that physician's prescription and without the proper channels, you're paying out of pocket for something that you may not necessarily need. Okay, so it's important to be aware of what's really the issue before you look for sometimes a Band-Aid for that issue.
And you have to remember too, oxygen, people I think forget, is a drug.
Yeah.
So we want to make sure that you're not on a drug that you necessarily don't need, that can, you know, as we know, as medications can cause harm too. So you just want to make sure that we're not causing harm when you necessarily don't need it. Yeah.
Oh, okay.
I didn't know that.
Yeah, I didn't know that either. To be
Yeah.
quite honest.
Cool. We're all learning things together today. Wonderful.
So if you can do without it, do without it. Is that what you're saying?
Well, I mean, if everything, I mean, the thing is if you're on oxygen, you're on it for a reason, right? So you have to follow the prescription in your physician, right? But there are individuals who feel the benefit of just that gas flowing in their nose, which is, there's sensors in the nose that like that sensation. But if you need the oxygen because the levels in your blood are low, stick with what your physician says.
Okay.
Okay. Yeah.
This is being terrific. I'm learning so much.
I know there's some questions we haven't answered. Ron, you asked a question about your cat uses Flovent twice daily, but he's unable to rinse his mouth. Will this be problematic? I'm not a veterinarian, so I'm not fully sure. There are different types of form of inhaled corticosteroids. I'm just going to put out an assumption here, but with our obviously we can't ask a cat to rinse, gargle, spit, but there are different inhaled corticosteroids on the market that are only activated when they hit lung tissue. So I'm assuming maybe that's a form, but or that's just not a concern that they have if the cat gets oral thrush. I really can't ask that, but that's a great question to ask your veterinarian.
I would just say give your cat extra treats after you've done the puffer, and that'll help them.
And lots of snuggles.
Yeah, that's my answer.
Hey, I'll definitely ask. This is the first I've ever heard of rinsing, so I'll definitely ask that.
Yeah.
Oh, wow.
And spit, rinse and spit.
And that's just for your inhaled steroids. So if you're not taking an inhaled corticosteroid like Flovent or any of those, you don't need to for your bronchodilator. So if you're just taking Ventolin, Atrovent, or if you're on Inspiroto, those don't have inhaled steroids in them. You don't need to rinse, gargle, spit. It's not going to hurt. If you are on a mix of both, sometimes they just say, I just get in the habit of doing it with anytime I use my puffer, whatever works best for you, but it's just rinse, gargle, spit with your inhaled steroids. Yeah.
So you don't need it for the albuterol?
No, nope. But if you were taking Trilogy, it does have an inhaled steroid in there. So you would rinse, gargle, and spit.
So like with the Noro, I'd need to rinse, correct?
With the Noro, you would, yes.
do.
Yeah, there's an inhaled steroid in a Noro.
Okay, great. Thank you very much.
You're very welcome.
Been really informative.
Good. Oh, I'm happy.
Well, I guess any more questions? We were planning this for an hour long now, Maureen and I. But I know the girls can stay a little bit longer because they had 2:30 in their sites when we first got organized.
There's a couple more questions actually.
Okay.
It looks like there's
from
just
Gina.
Right here, there's one that said, I've seen small spacers and large ones. Is there a difference? From my knowledge, no, there's no different. Well, there's always difference in them. A lot of it too will be preference on, once products come onto the market, there's always product complaints and suggestions. And sometimes some of the complaints are like when they first came out, like, this is big and bulky. How am I going to transport this around? So they have made smaller ones. It's just the design of them. Obviously, the longer the distance, the more it allows for the molecules to slow down, so less to spraying the back of your throat. But some of those are designed funky where they have like angles and stuff like that. So all of the spacers have a certain design to help slow down the spray, so less hit the back of your throat. And that's ultimately what the whole goal of the spacer is, to prevent less from hitting that back of your throat.
But then also there are ones for children as well, right?
There are,
Absolutely.
So
There's
maybe
ones with
that's about to be the
masks,
difference.
there's different ones in that sense.
There's disposable ones that you can flatten down and you use them maximum about 5 times, but they're easier to carry with you in your bag or wherever you may be.
There's a lot. So we could go on talking
Yeah.
about tons. There's some that you can use with the dishwasher, some that you can't, like it's a huge shopping area in that area. So
Yeah.
just really in the end, just making sure you have a spacer for your meter dose inhaler is the most important. If you want to get fancy and by the top of the end, line one, absolutely go for it. If you just want to make sure, if cost is a big thing, just get the cheap one, or whatever one you get from your doctor or the hospital. That one's going to suffice too. So
They're
it's just as
all
long as
doing-
you're using a spacer.
Yeah, and they're all doing what they're meant to do. It's just, do you want the flashy sports car or are you okay with the Oldsmobile? All are good. All are good.
The one thing I guess we didn't really mention, because I know we were only able to put so much, we could talk about these topics forever. When you will know when to replace it is when you start seeing it get coated on the inside. If you start seeing a white film really filling it up, that's how you know that static charge is starting to go away and it's time to get a new one.
All right. So in related to that, how do you know the medications are getting deep enough into your lungs?
I would say, and we'll see if Alexa agrees, but I mean, if you are doing the technique properly, so you're taking medication, that's going to be your first sign that you're going to optimize how deep the medication actually goes. But then if you're looking for that confirmation, what I would say is that you're getting control and relief of your symptoms. That's how you know the medications are going where they are and working where they're supposed to.
Absolutely. And one other thing I'd add on top of that is if you aren't using it correctly, so say you're taking a really fast breath in, you're kind of defeating the purpose of taking that slow, deep breath in. You hear that whistle yell at you, you're going to feel the side effects of that medication because you have blood vessels in the back of your throat. So if you take a really fast breath in, that medication is going to hit the back of your throat. And say if you're taking Ventolin, you might start feeling the jitters because you've got that medication now into your system, less into your lungs. So that's kind of another feedback is, hey, maybe I'm taking it too fast. It'll also whistle at you saying, slow down that breath. But that's another, that your symptoms should be improving and you shouldn't be getting the side effects.
Yeah.
Right. I have an offline question, actually. I received my email. And it says, I am on the Alvesco aerosol puffer. I use 2 puffs in the morning and 2 puffs in the afternoon. Lately, I'm having a really hard time getting the medicine out. I use a spacer. I shake the puffer, but it doesn't want to come out when I press down. Am I doing something wrong?
Sounds like there's no medication.
Yeah, it might be out, like the medication might be out, or perhaps it could be the fact that the patient, maybe it's not the right device for them. Maybe they're not strong enough because, arthritis, or I have the weakest little hands, I can't open a pickle jar. So pushing down on the MDI might be too hard for that patient. So it might be worthwhile going back to their physician and finding a device that doesn't require that strength in their hands, and maybe that's what it is. It could be the device, it could be,
You got to be able to push down on it to get the spray. If they're not able to generate that force, then assessing that or seeing if it's empty.
Yeah.
Those would be the 2 big things.
yeah, for sure.
And making sure that it's loaded in that boot properly. So as you can see that you can take the canister out. If it's not loaded in, it might be jammed. There's a couple things. I would take it back to your pharmacy or doctor to assess to make sure that the device still has medication in it and that it's loaded properly.
Yeah.
Sounds good. Karen has a question. Does your lung volume have anything to do with getting the medication into your lungs? I guess your lung capacity or,
The way that your lungs function are definitely going to impact how much medication you get in. If you are unable to generate a strong enough flow in and the device requires that, you're not going to be able to get the medication in. if you have, for example, COPD, it's an obstructive disorder. So you don't exhale all of the air from the previous breath. So we have what we call air trapping. If you imagine a balloon that can blow up this big and you take a full breath in, but then you only exhale halfway because you have COPD, you only have half that space to carry medication in. So then you take another breath in, but then you exhale only that much. And so that's where that shortness of breath comes from when you have COPD, is that you're trapping old oxygen depleted air in. And so it could in fact impact how much medication you can take in, because you can only have, your breath is only so big.
Mhm. And Lindsay shared a slide, where we talked about a slide earlier on our presentation. There's so many different devices, and some of these devices are very dependent on how fast you can take your breath in. So things like Symbicort and those devices, they're great medication, but if you can't generate a fast breath in to get that medication, so not having a good lung volume, taking a big breath in, you may not be able to actually pull that medication out of the device to actually get it. So something like an MDI or the Respimat, where it's a soft mist inhaler, might be a better option based off of your lung function.
Yeah.
Okay.
Okay, and I see one more question. I will direct this to the folks from Vital Air. So either Joseph or John. I think we have Jason as well online. So the question is, I use concentrators only. Can I use a tank as a backup?
So that would be totally depends on the prescription or what's the need, and also depends on so there are a lot of factors involved in it. If they need it 24 hours, they mostly have a backup. Depends on there's a lot of mobility and everything. So it has to come up with the prescription, and also has to come up with the funding agency as well. That answers the question, or?
Maureen, does that answer the question, or did you want to elaborate?
Well, I guess because I used to be a client of theirs, and because I was just using the tanks, and then when I went to just concentrators, I was told that I couldn't keep a tank on hand unless it was it was a monthly thing or whatever. So I always just worry about power outages. And with the concentrator, I have to use my portable, and it's no good for sleeping or whatever, or just running out. But I think it's very difficult to use a tank, to just have a tank on hand. I don't think that's possible.
So are you still with the home oxygen program, or?
No, because I'm on concentrators, right? I mean, I bought a concentrator, so.
Okay, so it's
yes.
a private. Okay, so it will be, as I said, it come up with the, it comes to the funding. So if you have a portable device, is that a portable oxygen concentrator you have?
Yeah.
Yeah, so those are the limitations. It all come up to the end, to the funding source. So you have a device that's portable, that will be a backup system. So your cylinders will not be an option at that time because of your funding restriction limitation.
Right.
Yeah.
Okay.
Did you say your portable source of oxygen was a portable oxygen concentrator?
Yes. Well, no, no, that's what I use when I go out. My
Yeah.
principal source is a concentrator that I keep in the other
Yeah.
bedroom.
Yeah, HOP only funds one modality for portability. So for you to have cylinders, that's one backup source, but you have the portable concentrator, so that's considered the second one. So that's not okay. It's a legitimate concern, depending on where you live, to have a backup cylinder in case there's a power outage. Some places get power outages for 24 hours, and
Well, especially since I paid for the portable one myself, right?
that is a source of frustration for some.
Well, I
people.
didn't really, my insurance covered it, which I didn't realize, but yes.
Sometimes, if you talk to your driver and give him, a Christmas present, and maybe wink, wink, nudge, nudge, he'll give you a cylinder to use in the event of power outages. But that is something that needs to be addressed, because depending on where you live, you could be quite a ways from, backup source of oxygen. Eh?
Right, and I don't have a driver to wink at because I don't. I'm not using the tank anymore.
All right.
Well, yeah, I understand the frustration.
Well, it's
We
something I
deal
can
with that.
talk about with my doctor and see what
Yeah.
prescription wise.
The other thing is that if you have extended health, obviously, every
Right.
5 years, they'll buy you more and different equipment. So if there's been a 5-year time frame between when you got your portable concentrator, you can ask your doctor to prescribe you a regulator, and which would dispense cylinders, and that would be paid for by your extended health provider once that 5-year duration is reached.
Right.
So that's another way to go. And if you call your your oxygen provider, then they might be able to look into the records and see, how long till you can do that.
Right. Right. Okay, I'll do that. Thank you very much.
Is there any other question from anybody in the room? You want to mute yourself? It is 2:15. And we've had a lot of questions. Great presentation from Alexa.
Yes, it was.
And then so glad to have them here, and also
And Joseph and
folks from Vital Air, also very informative. We will do this again, of course. We would love to have you back, maybe for another presentation. Before I let you go, I do want to direct your attention to a COPD research that you might be interested in. Let me just try and pull it up on my screen if I could.
So just so Maureen's bringing up a slide, a graphic I did. I didn't really introduce myself well. I'm the Director of Communications and Engagement. So I'm part of the leadership team here at BC Lung, and working with Maureen and Donna, who's here, to slowly, hopefully improve our patient support programming and offering, and certainly reliant on the smarts of people like Alexa and Lindsay, who I see many opportunities with. And now I've met Joseph and John. And anyhow, another thing that I'm involved in is I'm the contact point for often research coordinators and teams. They come to me to try and get the word out. So here we have an amazing team led by Dr. Don Sin. I don't know who knows him, but he's a bit of a god in the research world on COPD. And another very well-known researcher, probably less to patients, Dr. Sadat Savafi, because he's looking more at the population-wide needs. And they're collecting information because they're trying to develop tools to help you decide, your doctors decide the best treatments for you. And they're offering $50 to anyone that would diagnose COPD if they would spend 45 minutes on the phone with a lovely gal called Rebecca. They're not tough questions. And should you be interested in that opportunity to work as part of Dr. Sin and Dr. Sadat Savafi's team in speaking with this nice young woman, Rebecca, just drop a note to Maureen. You all have her email, and we're happy to put you guys in touch. And like I said, they're offering a $50 gift card, I think, to a range of places. You can pick from this or that. So just wanted to bring that up, since I think some of you indeed might be living with COPD, and it might be of interest.
I talked with them yesterday or the day before.
Ah, good.
And it was very interesting. It was easy.
It was easy, so it
Yeah.
wasn't hard going. Well, there you go. Well, thank you. Thanks, Maureen.
So if you're interested, my contact information is there. betterbreathers@bclong.ca. Just send me an email, with your contact information, and I'll forward that on to.
I don't think I have your email. I just checked. I just had the invite, the Zoom meeting. What was the email again, Maureen?
betterbreathers@bclong.ca. I will also type it in the chat box.
Okay.
Maureen,
Yes.
would it be possible maybe after this webinar to send out an email to all the participants with a link to the recorded video, should anybody want to watch this again, and to this information here?
Yeah, of course. This video will be
Yes.
posted on our website after I edit it down a little bit, and then it will be posted on our website on demand. And we, as usual, I send out an email with a link to where you can view the this
Thank
webinar.
you.
And maybe you can include this information as well.
And
That would be
then,
good.
Yes,
Okay.
of course. And information about this research as well will be included, of course.
Excellent. Thank you.
Yeah. All right. And I'm going to type in my information in the chat as well. So
Thanks, everybody. That was great.
yeah, so thanks everyone for attending today.
Thank you.
If you are
Thank you
not
very much.
aware of our or twice weekly exercise program, we host them online via Zoom. It's free. It's led by a kinesiologist, Jill, and she's great. It's Tuesdays and Thursdays online, 1 p.m. to 2 p.m. The information for that is also on our website, which I will type in the chat. But if
We've
you
got
just
a lot of regulars here, don't we, Maureen? I know Terry.
yeah, I'm not sure if George, I think you had mentioned something about exercising. If this is something of interest to you, please join. You know, like I said, it's free and it goes on until March. So we have, you know, we started this series this month, and yeah, and it's great, and it's twice a week.
And hey, a huge shout out to Alexa and Lindsay. I mean, what an exceptional presentation. Thank you very much. That was
Yes,
just
thank
great.
you.
Thank you.
Thank you.
All right. Is there any other questions or comments from the audience?
Go enjoy the sun. I see sun here. I got to.
Yeah, the sun is starting coming out. Beautiful.
Have a great afternoon. We'll be talking to you guys.
Thank you, everyone.
Take care, everyone.
Bye. Have a good day.
Have a good day. Cheers.
Thank you very much for the
Thank you.
presentation.
Thanks for
Thank you.
joining.
But
Well, that was informative.
Very.